This video consists of 3 segments: the pre-insertion and preparation segment, creating sterile fields and donning sterile attire, and the post-insertion procedure segment. We will highlight the key points to remember at the beginning of each section. If a break in aseptic technique occurs at any point in the procedure should be stopped. Please refer to the central line policy for the checklist and any additional information. Pre-insertion preparation. Remember to cleanse hands prior to opening any sterile supplies. Always refer to checklist. Inspect supplies for holes or tears. And use friction in applying ChloraPrep. We're going to start by cleansing our hands. It's always important to do that upon entry into the room and before touching your patient. The first thing we're going to do is verify the pertinent anatomy for this procedure. The preferred sites are the subclavian or IJ approach. The subclavian approach has the lowest rates of infection, thrombosis, and arterial puncture. It is also most comfortable for the patient. After having done that, we're going to start gathering our supplies to open and create our sterile fields. Okay, I've gathered my supplies. There's a few things you're going to need in addition to your central line pack. You will need some towels to catch any runoff from the prep solution. You will need some non-sterile gloves to wear while you're applying the prep itself, some sterile gloves for the central line insertion, and a sterile probe cover to drape the probe right before you use it. Okay, so I'm going to set these aside. Also, please remember to secure your ID badge or take it off before you open sterile supplies. We don't want it to swing over and contaminate our sterile field containing our central line insertion kit. Now we're going to open this package, and within this package there are some items that are wrapped in a sterile manner, and there's some that are unwrapped. So we're going to create our sterile field once we open. You always want to open sterile supplies with clean hands. I've just cleansed my hands prior to opening. Okay, so now we have the kit contains your cap and mask. Here's your prep solution, which you're going to apply first. This is our central line kit. We will open that just prior to using it. We have a gown, and then we have our drape. If you're wearing any jewelry, it's important to remember to confine that jewelry within your scrub cap. Okay. Now we're going to apply the prep solution. So what we're going to do is just place a towel underneath the patient's shoulder to catch any runoff. There we go, just a little bit there, to avoid any pooling. Non-sterile exam gloves are acceptable to apply ChloraPrep. Now ChloraPrep is an alcohol and chlorhexidine solution. Alcohol gives you the instant kill. Chlorhexidine gives you that persistent activity and preventing the further growth of microorganisms. Now, it's important to remember that chlorhexidine needs to be applied using a scrub motion. You want to gently squeeze the wings, press down and let the sponge fill. Okay. This is applied using a little bit of friction. What you're going to want to do is, once the sponge is filled, prep over both the IJ and the subclavian areas. Those are the preferred access sites for 30 seconds.
We prep approximately a 4x5 area with this 3 ml applicator. And we're going to want to let that dry thoroughly for a minimum of 30 seconds. If in the event it is necessary to do femoral insertion, you need to do an additional scrub time of 2 minutes and an additional dry time of 1 minute.
Creating sterile fields and donning sterile attire. Cleanse hands prior to donning sterile gown and gloves. Do not reach over a sterile field if you're not wearing sterile attire. Always face a sterile field while you're wearing sterile attire. Keep sterile hands above your waist. And do not touch the underside of a sterile drape.
Okay, we're going to remove our gloves. And I'm just going to cleanse my hands before I open and create my sterile fields. Thank you. Okay, so while that's drying. So in this pack, there are some things that come sterile and some things that come non-sterile. This is the inside of the gown. It's appropriate. It's here. What I'm going to do now is open my sterile drape and open my kit. Now, when you're opening any sterile supplies, it's important to remember to check for holes or tears in the package. If there are, it would be considered contaminated and you'll want to replace it. Make sure you don't reach over any sterile item when you're opening it. You want to go to the side so as not to reach over the sterile field. And we'll be able to access that once we put on our sterile gown and gloves. Okay. The next step is to open our sterile pack. This is the insertion kit. It is wrapped in a sterile fashion within the kit itself. So you use the same method as when you were opening your drape. Only touch the outside of the package, or outside of the wrapping, which is the underside. Never reach over the sterile field. Okay. And we're going to let that be. This is now a sterile field. You see, it's kind of confusing. There's blue and blue, but that's a sterile field. Okay. We're going to open our gown and gloves. Important to remember when you're putting on a sterile gown that you don't reach above your head at any time while you're putting it on or while you're wearing it. The sterile area of a gown is your chest to your waist and the front only to 2 inches above your elbows. So we want to go side to side, and we always want to face our sterile field. So our gloves and our tray are our sterile field here. Gently let it drop to the floor, one arm, then the other. Again, always keeping our hands above our waist. We recommend the closed glove method. The closed glove method is, by definition, it means that your hands are inside of your gown sleeve until they're all the way inside your sterile glove. So we want to gently place the palm of the sterile glove aligning with the palm of your hand. The cuff of the sterile gown should align with the opening of the glove. We want to gently grasp the cuff with our thumb through the gown sleeve. And we're going to be going up and over with this hand while we're gently advancing our hand into the glove with the other. Now we'll just have any minor adjustments as necessary. Always touch the outside of a sterile glove if you need to adjust. You want to make sure you're only touching the outside, never the inside. Okay. Same thing with your opposite hand, palm to palm. Okay. The openings should be lined up next to each other. Gently grasp the cuff with your thumb, and you're going to go up and over with one hand while gently advancing into the glove with the other. Okay. Down. And then we adjust. Now we're wearing our sterile attire. Anyone assisting with the insertion of the procedure, and the inserter, him or herself, will need to be wearing a sterile gown and glove as I am, and a cap and mask. Anyone in the room that's not directly involved in the insertion needs to be wearing a cap and mask. Okay, right before I drape, I'm going to turn, which closes the back of my gown. Thank you. Now, it's important to remember that the sterile area of your gown is chest to waist in the front only, to 2 inches above the elbows. You always want to keep your gloved hands above your waist, and you always want to hold the drape at or above waist level to avoid letting it drop below, so it will be contaminated. We use a full body drape. There's a hole in this drape. It's called a fenestration. That is the area that's going to be placed over the potential area of incision. It's important to remember that you don't place your sterile gloved hands on the underside of the drape because the patient and the bed are not sterile. You always want to protect your gloved hands, keeping them on the outside. And you want to avoid leaning into the patient to contaminate your gown. Okay. Just place this over your face. Okay. Okay. Slowly open. We're going to open toward the head first. Again, don't lean into the stretcher. We want to protect our gloved hands by keeping them on the sterile side of the drape, never on the underside pulling forward because that will contaminate your gloves. Toward the head initially. What we're going to do is turn, protecting our gloved hands. We're going to advance the drape towards the foot. Again, this is a full body drape. You want to make sure the head is fully covered. Before we do anything else, it's important to make sure that your drape is adhered in all areas before we start the procedure. You okay? Mm-hmm. Okay. Now the drape is applied. We're going to drape our probe. So this is wrapped in a sterile manner. I'm opening it on the sterile insertion kit field. Okay. This package contains your probe cover, 2 rubber bands to secure your probe cover, and the sterile gel that you use during the procedure. Okay. Now, the easiest way to drape a probe is to hold your hand in the open portion, come through with the other hand. Your assistant will place non-sterile gel on the probe itself, and then we'll use the sterile gel on our field. Okay. Grasp the probe firmly. Go ahead and pull down. So at this point, it has a sterile cover on it. We want to come to our field, and this needs to remain on your field. You can apply the rubber bands to keep the drape in place, or the cover. Okay. And you can use the sterile gel on your field wherever necessary.
Post-insertion procedure and dressing application. Apply the transparent dressing using aseptic technique. Cap the lines to maintain a closed system. Remember to complete the checklist upon procedure completion. Remove drape while wearing your gown and gloves. And dispose of sharps in an appropriate manner.
Okay, now we've completed the insertion portion of the procedure. Please remember to secure the catheter and apply the dressing using a sterile technique. It's also important to remember to complete the central line insertion checklist and also assess the need for the central line on a daily basis. We're going to remove the drape, and we want to do this wearing our gown and gloves. We want to protect their clothing. Just roll it in upon itself as this is soiled. Okay. To remove your soiled gown and gloves, you untie at the waist, pull to break. Then carefully roll the gown in upon itself to contain any blood or body fluids to avoid contaminating your clothing or your skin. Now, it's also important to remember that there is a sharps receptacle within the kit itself. Please use that at the end of the procedure, okay, and dispose of all sharps properly.
Most central line associated bloodstream infections can be prevented by limiting the use of central lines when possible, proper techniques for insertion of the central line, removing the central lines as soon as they are no longer needed, the use of central lines with as few lumens as possible, and following recommendations for maintenance of the central lines.